I'm Ned Jenny, licensed psychologist, founder and CEO of Edward Jenny and Associates in West Grove, Pennsylvania. I want to talk to you today about how we go about diagnosing ADHD and what a self-report scale actually gives you. So let's say you take a screener, a screening scale, and you get a high score and it says you have ADHD. Well, let's give that a little bit of context and a little bit of nuance because there's a little more to it than that. And we want to get this right because we want to make sure that we're treating you for the right thing. If we're treating you for the wrong thing, that can lead to a lot of frustration and maybe even worse symptoms. So we want to try to get this right. So first of all, what does a screener do? A screener measures the presence or absence of a symptom, and they're pretty good at that. They are what we call sensitive, meaning that if you are experiencing a symptom, it will ask you a question that will identify that symptom. But what it doesn't do is tell us what that symptom means or where it comes from. The screeners lack what we call specificity. They're sensitive but not specific. And that's where a more thorough assessment can figure out what is this symptom coming from. So we have a symptom that is on our website. You can take it, get the results, and you can take that first step in the assessment journey of figuring out whether you have ADHD and what to do about it. So we have one called the ASRS, the Adult Self-Report Scale, or ADHD Self-Report Scale. And it's just a list of symptoms that you rate about yourself. So for instance, how often do you have problems remembering appointments or obligations? Now, if you have ADHD, you may have that symptom, and you would identify, I have that symptom often, or I have that symptom all the time. You can rate it on a scale. So it is true that people with ADHD have that symptom and may struggle with remembering appointments. But here's where it gets a little tricky. There's a lot of other reasons why people might have trouble remembering appointments. So let's talk about a few of the big ones. Anxiety can look a lot like ADHD. People with anxiety often have racing thoughts. They have an inability to settle down and stay focused, and they can look very ADHD. Perfectionism, ironically enough, can look a lot like ADHD. People can't finish tasks because it's not quite the way they want it to be. It's not quite perfect, so they're never quite done. And that's not ADHD, it's perfectionism. People with trauma have a nervous system that is on high alert. They're scanning their environment. They're what we call hypervigilant. And these folks have trouble focusing on the important things because they're scanning for threats. And they're rightfully doing that because their trauma experience has led them to be very alert for any signals of danger. But they don't have ADHD, but they may look like they have ADHD. Burnout is another one. People who are burned out are foggy. They can't stay focused. They have a hard time getting things done, but again, not because of ADHD, it's because they're burned out. There's another one that's called pathological demand avoidance, really fancy term, that basically means that some people experience such discomfort in completing tasks that they'd rather just avoid it than put themselves through the pain of getting that project done. So they don't get things done, but again, it's not ADHD, it's an avoidance tactic that is a coping strategy essentially that has become maladaptive. So why is this important? Why do we care whether it's ADHD or something else? Well, people who have ADHD typically respond well to stimulant medications. But what if you have anxiety and you take a stimulant medication? Well, that could make the symptoms much worse. And then you're more anxious, not less anxious, and we're treating the wrong thing. We want to make sure that we're giving you the behavioral strategies and the therapies that are appropriate for the thing that we're treating. So if we're mistakenly treating anxiety as though it were ADHD and recommending a stimulant, then you're going to get worse rather than better and more frustrated and maybe feel worse about yourself. And we don't want that. We want to be treating the right thing. So We don't want people to go through repeated failures in treatment. And a lot of people that we run into have been treated well, but for the wrong thing. So it hasn't worked, and the person's frustrated. They come to us and they say, what is going on? Why do I continue to have these problems? So the right answer can change everything down the stream, and that's what we want to make sure that we're doing. So there's obviously a big difference between a 20-minute screener and meeting with us for a thorough evaluation, where we're going to take into account all the possible reasons for the symptoms being present, and we're going to give you an appropriate diagnosis and appropriate treatment. So if this sounds interesting to you, I encourage you to click on the link on our website, book an appointment, book a discovery call with us, find out what might be involved, and we'll take it from there. Thanks for listening.